Same was
Mm-hmm.
happening with me as well.
Mm-hmm.
So first thing, I was in search of a good mentor, and I
Mm-hmm.
had attended your free sessions, and then somehow I could connect with you, and I said, no, I have to get a one-on-one mentorship with Naseem sir. Then I
Mm-hmm.
contacted you. I think you were a little sick, during that phase. And I got anxious. I said, why sir is not starting? Why sir is not starting? Okay, then we really caught up. Then you told me, you actually at every step you encouraged me. You told me you got the required knowledge, only structure is needed, and that structure you gave. And I think that moment onward, then it was like an upward graph only. And
Mm-hmm.
one more important thing is I got good study partners along with a great mentor. If you have got good study partners, then it makes your job a lot easier.
So
So
good
my
partner
study
is always
partner,
good. Mhm.
yeah,
Yes, continue, doctor.
yeah. So my study partners were in my study partner group also, sir. My result is 75%. Would have been 100%. Had not one of my friends not failed by only 1 mark.
Mm-hmm.
So my study partners were Siddhi, who passed. I'm so happy for her. And
Siddhi
she was
always
my
give
online as
news
well as
about
offline
you.
study partner. Sorry, sir.
Siddhi always give news about you that how was your
Yeah, I
exam.
know, I know, I know. Yeah, so we used to push each other. And we were blessed to have a world-class premier hospital in our Mumbai city, like King Edward Memorial Hospital, where we both used to
Mm-hmm.
go together, do the cases, used to observe each other, used to give a few tips to each other. We used to revise each other with each
Mm-hmm.
other, and that has helped me and I think both of us immensely. So she
Mm-hmm.
passed with flying colors, so did I. And one of our study colleagues, Sanjana, though she got 142, I think she just couldn't cross just by 1 mark. So she's
Mm-hmm.
almost there. And my fourth partner also, Dr. Rameshwar also, he was also my last few 10 days uh, online study partner. He also got through. So study partners are very, very important. They push you that extra bit to cross that line.
Mm-hmm. Sanjana also did very well, but her might be her luck is not.
Yeah, yeah. So along with your hard work, your luck has to be there on your side.
Mm. So, doctor, how do you feel that means how much important is to go visit the hospital and see the cases? Because many candidate, I think nowadays they are lacking in this clinical stations.
Yeah, so I think it's enormously important, sir, to go and
Mm-hmm.
have an actual feel of the patients. Not
Mm-hmm.
only have a feel of the patients, but to restructure your presentation within stipulated time. Because in exams, sir, you just go blank, whatever is at your
Mm-hmm.
final level, you start doing that. Your brain freezes. My also had got frozen. And you
Mm-hmm.
you can very well make out that because I had gotten into my shell after my exam,
Mm-hmm. Yes, yes.
but because of a tireless practice on the real patients, I think
Mm-hmm.
we were able to sail through effortlessly.
Mm-hmm. So, what about preparation apart from this online course and the partner? Any book you think that is good for preparation, or any suggestion you want to give? Because many candidates get confused. There are many books are there. What to read? What do you think? Which type of book is good, or is there any benefit of reading books?
Books have their roles, but don't want to give too much importance to books. It all boils down to how well practiced you are,
Hmm.
and how effectively you're doing it. With your partner, in front of your partner, with your mentor, especially, because they are the ones like you prepared me for this, and
Hmm.
you were the one who could spot what were the mistakes I was making, how I should, correct them and how should I present them again. So that helped enormously. And books wise, yeah, I read a few books, but at the end of it, it's all about your confidence, your practice,
Hmm.
that helps you to sail through. I basically found a few books like Rupa Besant was good. Ernest Suresh, I thought was good. Me and Siddhi, we finished that book in last 3 to 4 days. So that was good. Yeah, reading books are good. You feel that you got knowledge, but ultimately on the day of performance, it's like how well you practice. How well you are practiced,
Mhm.
how good you can present yourself. How confident you are. That is more important.
So, any tips regarding the day of exam, or what do you think? Means you have given the exam, so any experience you want to share on the day of exam? Means.
So the day of exam, I would say just be calm. Don't read any books. Just revise in your mind, what you have done so far, is good enough, and be confident. Be confident. Face the examiner confidently. Basically, the examiners are there to pass you. They don't
Mhm.
ask you like in-depth knowledge of the subject. They are not there to fail you. They basically want to pass you, provided you don't make any gross mistake there. You be
Mhm.
confident. That's my message. Be confident. Whatever you have practiced so far, if you have practiced it well, you have practiced with a good mentor and good study partners, that should be enough to make you through this exam.
So, any other things you want to say? So, doctor, how you feel that if one station, many candidates are telling that which station your went wrong and how you manage it after that?
Yeah, so I started with station 3. Even my Bangalore mock was, I had started with station 3, and I had flunked that Bangalore mock exam by 1 mark only in differential
Hmm.
diagnosis. So I started here again with station 3. I said, oh my God, again the same thing is going to get repeated. So
Neuro
yeah,
and cardio is very difficult to handle.
yeah, 1 mark. No, sir, failing by 1 mark is a terrible feeling. I
Uh,
can just imagine how other candidates must be feeling who failed by just 1 mark. So I started with cardio. I had a patient with Marfan's, had got good features, keloid scar and
hmm.
DVR. So I confidently examined the patient, presented the case, and I was thinking in my mind, is it really DVR or just aortic valve replacement? But then I was confident, I had seen these patients, again and again during our preparation. So
Hmm.
I presented confidently. I got 19 out of 20 there.
Okay, very good.
Then immediately my neuro patient was a Parkinson's patient, DD being normal pressure hydrocephalus. There also I examined, as we examine, and
Hmm.
I finished examination well before time, and then additional examination I did, like I asked him to write his name and signature. It was
Hmm.
typical. So they asked me a few questions. Not in-depth knowledge of the subject is needed again.
Subject. No.
If your
So,
technique is proper, if you
uh,
present it properly and confidently, they don't expect you more than that to do. So I got 18 out of 20 there in Neurostation.
many
Then,
candidates, they are wasting
yeah.
much time in reading books. Okay, so I don't think that is really required. What?
No, I do agree with you, sir. I mean, books have their place, but ultimately, you have to just keep practicing, 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 and find a good study partner. Of course, one has
Yes.
to a great mentor like you.
Hmm.
But apart from that, I'm saying, study partners are very important.
Hmm.
They push you that extra hard, and
Hmm.
that is what
And
is needed.
And you feel motivated throughout the preparation. Otherwise, it's
Absolutely,
very easy to
absolutely.
become demotivated. So one will
Yes,
push other will push. Okay, so you feel motivated, and
exactly, sir. Exactly, exactly. So
so
my communications, both the communications, I thought, maybe I didn't give good differential diagnosis. I thought maybe once you think that differential diagnosis were not good enough, then you must have, gone wrong there onwards. But
hmm,
you had prepared me, or rather us, so well, so the history wise, the start was so good, differential diagnosis were relevant, so in spite of missing a mark by one or two things, I got good marks in both the long clinical consultation. Of course, my uh, other stations were good. So yeah.
so doctor, you feel the time is enough for the examination? Many candidates they get confused, sir, how to examine everything in 2 to 3 minutes, or time will be there or not. So what do you think? You have given the exam, so.
I think time is enough, provided you have practiced it again and again,
Mm,
and many times the same thing.
mm.
Don't think that oh, you have examined this patient, and now you can do it. Exam pressure is very different. You just get
Correct.
frozen there. So
Mm,
so keep practicing same thing over and again. Till
mm.
the time it comes. Yeah.
And what do you think, this common cases practice required, or you should go for some rare cases practice?
Rare case is very rare. Let me
Mm.
tell you, common cases are very common. Concentrate on common cases. And those are the things, which are ultimately going to give you pass. And even if you don't do well in one or two stations, that's not the end of it. Don't just keep thinking about it. I know it's better said than done, but just don't think about your poor station or bad station, because it's not ultimately just one station which will pull you down. It's the your collective effort, of all the stations. And if you are confident enough, and if you don't do silly mistakes, I mean, nobody can prevent you from passing this exam.
Mm. So one doctor is asking that is the 2 month intensive preparation is enough for crossing this hurdle?
It again depends, sir. I think we had started November onwards, right, sir?
Correct.
So I had started my preparation 4 months in advance. I got my slot in November, end of October. I got, and I immediately decided to go with Naseem sir. Of course, I think I came across many mentors, but then I found that Naseem sir was my mentor. I immediately decided, and then we started our preparation. You gave me a good time, and afternoon time was also
Mm.
quite comfortable for you and me as well. I could
Mm.
learn a lot from you. And of course, then I started, studying with Sidhya as well. She was a good study
Mm.
partner. So yeah, I mean, I'm thankful to all my study partners as well as I'm thankful to you ever, sir.
I think Siddhi is there. Dr. Siddhi, are
Yes, I'm there. I'm there. I was just about to
you?
thank Dr. Sachin in return because it's very mutual. Whatever he's saying, I'm going to just repeat that only. Sir,
So how you are feeling, Dr. Siddhi?
I feel somebody's taken at least 100 kg over my body. It's just gone somewhere. That's the exact feeling I'm getting like since yesterday. I was having shudders, I was having rigors when I was checking my result. I
Uh,
just didn't know that I'm going to do well or no. I just didn't want to fail by a mark. That was a bigger target.
yes, yes, yes. We are worried about this only. I know that you will pass 100%. Once you give me the feedback, I was 100% sure that you are going to pass.
So only
But
you were sure.
uh,
I guess that's what a mentor is all about.
so, so Siddhi, share your experience. Sachin already did it. Okay. So anything you want to add? your experience,
So,
how to
so
prepare. You
yeah,
are
a
a
lot of things.
dermatologist, okay? So many candidate might be not from the general medicine side. So
Okay, yeah. So a couple of things, sir. Like Dr. Sachin very truly said that having a very good mentor is very important. At the same time, having a very good study partner is very important. Like, what used to happen is that when we used to go to see cases and all, sometimes there are certain things which you do not get and the other person gets it. And
correct.
that becomes such a positive feedback that if he could get it, what was wrong with me? I had read the same thing. I have practiced it. Why couldn't I? And
Hmm.
that is such a positive reinforcement. It will force you to go back home and go through that case again, you know? So,
Hmm.
very, very, very important to have like a good study partner, a motivational one, wherein there is a lot of healthy competition. And
Hmm.
I still remember Dr. Sachin got his result, and I don't know, I am assuming that, he gave me a call
Hmm.
and I did the same thing. I got my result and I called him, and I was like so thankful, overwhelmed, literally in tears, but it just happened.
I was waiting for the message. Okay, so I know that result is out. Okay, so but I was waiting for the your message. So
So, sir, yes, very rightly, I'm a dermatologist, and honestly, the same time when Dr. Sachin got his allotment, I got mine. Okay, and honestly, sir, I was clueless what I'm going to do because I still remember making calls to Sanjana and Sachin and asking, "Ki where do we start?" Like, there's no A, there's no Z. I mean, where do we start? And mm, for me, my work was very, very challenging up until end of December. I
hmm.
had pushed a lot of things with respect to studies from January. Okay. So
Hmm.
somebody raised a question in the group that is 2 months of crazy studying enough? Um, I did that. Okay. Like, mid Jan to mid March, I went crazy. I really went crazy. I studied, but that's not very healthy. See, I am a person who is used to doing a lot of last minute work. Okay. Like last 2, 3 months, because probably in my
Hmm.
work, I cannot devote more time.
Hmm.
It's a promising job.
Hmm.
I mean, it's a demanding job. So if you are
Hmm.
one of those person wherein you are confident that you will be able to give all that you have in the last 2, 3 months, I would say go for it. Just trust your instinct and go for it. That's what I did,
Hmm. Hmm.
right? And
Yes.
one more very important thing. One day, me and Dr. Sachin were just casually asking each other, how much are you expecting, even before we gave the exam? And trust me,
Hmm.
that was another motivation. I would suggest everybody should aim only for full marks. Only for full marks. That's when you pass. Because when you aim for full marks, you are
Hmm.
over prepared, and this exam in the first shot needs over preparation. If you are over prepared,
Over.
you have a little bracket to go wrong somewhere. If you
Hmm.
are just prepared, probably you will go wrong in more than one or two places. But when you are over prepared, you can just go wrong probably somewhere at one or some two place, wherein there's still scope to pass by a margin, which happened with me.
Hmm. So this exam is sometimes surrogate also not well prepared. So if you are over prepared, it will help you. Okay.
Yes. Yes.
So some minor mistake can happen
Yes.
even by
Yes.
surrogate. So it will
Yes.
there will always be a
Yes.
safety
Yes.
there. Means the marks are there, so
Yes.
compensate. Otherwise, if
And
you are online, it's
yes.
difficult. Hmm.
And for another thing is presence of mind. Sometimes we are so bogged down with the exam day itself that we just stop thinking. Now, what happened to me? This is like something which was very funny. Okay.
Hmm.
And when I was sitting outside my center, there was a waiting area. I was sitting there. Okay. I
Hmm.
saw these two doctors who were walking in the lawn. Okay. And they came out from the OPD. And trust me, you sir, these two were my long clinical consultation surrogates.
So you know that both has no
Yeah,
finding.
exactly. I mean, I knew right from the beginning that I'm not going to get anything in those two. My history
Uh,
has to be apt because I'm not going to get any findings in these two.
hmm. And Yes, so it's a means it's a very good thing that otherwise some candidate make a sign. Okay, so making a sign is a very bad thing in PACES exam.
Yeah.
Mm,
Yes, sir.
mm,
Absolutely.
mm. So how much marks, Siddhi, you got in consultation?
So only thanks to you and to all those who are hearing me, this man teaches another level of consultation because I was so horrible at it. Once upon a time, I really thought. And it's just the way he pushed me. I have scored an out of in both my long clinical consultation, and sir, it all goes to you. For my long clinical consultation, the credentials and credibility goes only to you. And I'm really thankful,
Thank
sir.
you. Thank you so much.
And sir,
As
little tips of yours, do your just make sure that your presenting complaints is nicely explored, then find the
mm,
causative factors, then go to the complications, then go to the associations. These things were like always ringing behind my head,
mm,
like,
mm,
even if
mm,
it's a simple case. And sir, besides, you asked Dr. Sachin one question, that is it important to do a rare case? Sir, I believe that the expectations of the examiner from a candidate is much
mm,
higher when it's a common case, and it will be
mm,
as good as not there when it's a rare case.
right.
So
Mm,
it's always good to prepare yourself for simple things, because 90% of the times it's going to be simple things which is going to appear in front of you. Probably 5-10% of the times it'll be rare, but you'll do something and come. Now, that's just hard luck. And probably they are not expecting too much out of you in that scenario.
mm. So any tips, Siddhi, you want to give, or any book you think that you read and you find it's a very good for candidate?
So for me, so in this case, I have a little difference of opinion, because one is um, I don't have a medicine. I have not done my MD medicine. I was an MD dermat. Okay. As a
So,
result of it, sir, I needed a base for preparation. I had to read something,
correct.
right? So,
Mm,
one was that whatever I had read was from OST. I used to keep referring to Gautam Mehta. There are these
mm,
very old volumes which I was referring to, but that was somewhere my baseline book. Like if I had to go and check anything, I would go and check in it. And that has really helped me through. And so for clinical consultations, I used to go through Rupa Besant
mm,
and, small things here and there. Like we had done the,
mm,
yeah, like small booklets that we had, but mainly it was Rupa Besant and OST. These used to be my baseline.
Rupa Basant is also very good book, no?
Yes,
Particularly
sir.
long clinical consultation, very good.
Yes.
Mm,
Especially that question answer section, and how they have explained all the findings of a particular case. It's very
mm,
nicely put in Rupa Besant.
correct, right. So in the message, Siddhi, you can read? Someone is writing, dear doctor,
Sure.
can you able to read the message? Someone
Dear
is.
doctor, can you share regarding your instructions given in both LCC? Thank you. Is that person asking what were my long clinical consultations?
I think so. Just I think it's they want to know that what was the instruction given, means presenting complaint from outside. What was the?
Okay. Okay, so I began my exam with station number 5. Okay. And
Mm,
to my amazing surprise, station number 5, my examiner was the examiner who is there on the MRCP website. Uh, these videos, 2024 videos. I don't
mm,
remember his name. It starts from M, but he
mm,
was my first examiner, and my long clinical consultation number station 5 was a young man who had a bloody diarrhea and mucus in the
mm,
last 10-15 days, I believe, and he had been on a trip to Thailand.
mm,
And we had to take his history and examine him. And one more additional factor was that his grandfather was recently diagnosed with bowel cancer.
mm,
So that was my long clinical consultation one. But after taking the history, first it seemed like, it's a bloody diarrhea after he's eaten food from outside. And but he had a back history of bloody diarrhea on and off in the last 3-4 years with the occasional mucus in the diarrhea. He had a lower backache. He had history of inflammatory bowel disease in one of the cousins. And so everything put together, he had an inflammatory bowel disease. And the main concern of the patient in this long clinical consultation was, do I have bowel cancer? Which I was expecting right from outside, because uh, that was put up. So yeah, the examiner tried asking me all the questions related to that. That was one. And the other long clinical consultation was a young man who's 25 who had presented with hematuria, 2 episodes, and some pain in the abdomen. And he gives on past history, he gives me history that once he was playing football, and just after playing football, he developed an episode of hematuria. So, and his sister had berries aneurysm, as in she had bleed in the brain once upon a time. So everything come together. It was an autosomal dominant polycystic kidney disease patient who had presented with hematuria. They wanted differentials. So yes, I gave them the differentials that they wanted. So yeah, these were my 2 long clinical consultations. If I have answered that question.
So again, congratulations, Dr. Siddhi. So
I am so grateful to you. You've been just there. I mean, at a point I really thought, I am not giving the exam, you are giving the exam, because you took complete responsibility of our exams. Like a mentor who
I agree with Siddhi. I agree with Siddhi on this.
I don't know if anybody other than you, sir, has asked me a detailed feedback of what all was asked, and how did you present? What did you say to this? And did you ask a particular question? And on the frame of that, you told me that you're going to get through. I was still dicey. I mean, seriously, sir. This is something which is, I mean, we are blessed to find a mentor like you. We are really blessed. Trust
thank
me.
you.
And I highly recommend, sir. I have a small suggestion though. Very small suggestion.
Yes, doctor.
So the way you have mastered all the candidates in long clinical consultation and communication, sir, if you could just, start mentoring clinical stations too. Really, sir.
Okay, thank you. We'll try to do it.
Yes,
Okay.
sir, that would be great. That would be like a complete package with you only.
No, actually, in our regular session, we are doing few cases of abdomen, respiratory, and neuro and CVS also. But it's slightly, it means I feel that the candidate must go to the hospital to see the case. But theory wise, we can able to cover it. So we'll consider Dr. Siddhi. Thank you for
Yeah.
giving your suggestion. Okay.
So, because what I realized is the long clinical consultation after a point, after doing the sessions with you, it was as good as I didn't have to even look through it, you know.
Mm,
So that
mm,
confidence building in a particular sector is important. And I feel, if you could just push, I mean, maybe theory wise, I don't know how you will do it. I'm sure it's difficult because that's more
mm,
like a video demonstration of science, and to pick those signs for a candidate
mm,
who's presenting on
mm,
a Zoom session. I'm sure
mm.
there's a lot of technical glitches in it. But sir, if you could just try, this is just like a very vague suggestion.
So thank you so much. So we will try. Okay. So I will try my best to announce a course also, and will try to. So thank you so much for this suggestion, Siddhi. Okay.
No worries, sir. No worries
Okay.
at all.
So I think Janvi is not able to make it. I think so. She is not there. Dr. Janvi, I think she is not there. She is not able to make. So any other advice to our candidate, Siddhi, you want to give?
Sir,
Or
so that's what I said. Books are not very important. Like, see, if you have like an MD Med ka background, I don't think, you guys need books. I just wanted to make a base for myself. That's why I read a certain something. But practice, practice, practice on the D day, it should come only at a spinal level. Like you're going there and recipe mein this is happening. Okay. It should just go like that. Only then you're going inside to find the signs. Like you don't want to go inside and memorize what I'm going to do next. You have to go inside and just think what I want to find in that case, so that I'm going to give my diagnosis. That should be the approach. And I'm sure everybody, so I just feel for this exam, like, because most important limiting factor in this exam is, so the uncertainty to get a slot. That's the biggest limiting factor. And for me, that was the most important drive and incentive, that I want to give everything that I can give in this shot, and then I will see if it doesn't work out. But I first want to give everything to this shot. If that is probably the approach, and if you are aiming for very good marks, I'm sure you'll pass. That's how it is.
Correct, correct. So once you get a slot, give 100%.
Yes.
Try to make it as far as possible. Don't give up. So anyone has any questions to ask to Siddhi or Dr. Sachin? You can unmute and you can ask. Anyone has any questions? So what some candidate are telling about this surrogate. So how you find Chennai surrogate, Siddhi? You find any different or any
both
how to manage it, this issue about surrogate problem? Do you think it's really a big...
Yes, I agree. I agree, sir. It is something which is again a limiting factor. It's if it's your hard luck and you get somebody who is not receptive. So, sir, what I feel is that when you start conversing with a person, in the initial first few seconds only, you come to know how well trained that person is. Like first few questions only, you come to know how well trained the person is. I believe initially only if you get like the slightest instinct that probably you're not getting what you're wanting to get, it's best to turn to the examiner and tell the truth, that the surrogate is not probably being able to interpret, or you need an interpreter or whatever.
At the beginning,
Yes.
I mean, within 1 minute, you must inform the examiner.
Yes.
So at least they will have an idea in their background that there is a problem with the
Yes.
candidate.
And you have very humbly told them if they do something about it, then it's a plus. Even if they don't do anything about it, probably they know that something had gone wrong and they will count that.
Correct.
So it's, so like in my cardio station, I told you it was my mistake that I missed seeing a scar on a person who had a lot of hair on the chest. But the moment the examiner was very sweet, he was leading me. He was asking me that, listen, in this age, what are you suspecting? I told him that I'm suspecting an aortic stenosis in this patient. I hear a murmur which is not radiating to the carotid. But sir, immediately when he started leading, the next thing that I told him was, sir, I think I have missed out on something, and that's the reason why I'm not being able to join the dots. It just shows that you are humble and you are accepting that probably you've gone wrong somewhere. So, be very humble in your exam.
Yes, correct. Don't try to defend yourself by giving wrong answer or wrong way, correct?
Not at all. Yeah, not at all. And the way Dr. Sachin said, he is absolutely correct. They are not there to demean you, or they are not there even to judge you. They are literally there to pass you. Because after a point, when they see you fumble, either they switch to the next question immediately, which happened to me in 2 stations, or they start leading you to the answer. Either of the two.
Someone is asking, your center was MGM?
No, sir. My center was Sundaram Medical Foundation.
Okay.
So technical glitches were not there in that center. And as far as the surrogates were trained, both my long clinical consultations, I assume, were doctors. They both
So
were
you,
surrogates. The way, yeah.
so they are the
And
one who is giving the history and also you
yes,
examine on them. Correct.
like when I was asking the surrogate in ADPKD case, the other long clinical consultation, that I want to examine you, is it
Hmm.
okay? You know how he helped me? Being a surrogate, he told me, can you finish examining me completely in my sitting position, whatever you are left with, then I'll lie down for you. This is what he told me.
Okay, okay, okay.
This was quite a helpful thing, that, you are going to end up losing marks in patient welfare. So you do everything in sitting and then make me lie down and you finish your examination. So
Correct.
surrogates also help if they are well trained that way.
Correct.
It's a good center, sir. I did not find any major technical glitches with the center. It was a only thing, our exam was conducted an hour and 15 minutes late because I believe somebody didn't turn up or something. But they came and told us that there is some technical glitch and exam is going to be postponed by an hour if we were okay. And yeah, we didn't have a choice. We had to say we were okay.
Okay, Siddhi, thank you so much for coming and joining our session today. So I think Janvi is not able to make it. I think she is busy somewhere.
No,
So
sir. Thank you. Thank you so much. Thank you, Dr. Sachin. And thank you, everybody who's listening to us. Hopefully, all of you will be in our position one day. Just give it your best. That's what I would say. And good luck.
okay, okay. Thank you so much, Dr. Siddhi and Dr. Sachin, for coming today and
Thank you.
giving your valuable advice to our candidate. So,
Yeah. So thank you very much, sir. And we would like to invite you to come down to Mumbai and celebrate our success.
hopefully soon we will come and
So
see you.
please do. You have asked
Ab-
for a party and you deserve one.
yeah,
Take
absolutely.
time.
This is not just our success, it's yours. It's yours. It all belongs to you.
Thank you. Thank you so much. So we'll meet soon in Mumbai. Don't worry.
Absolutely. Absolutely. Yes.
Yes, sir. Please, please. Yes,
Okay.
for sure.
Okay. Okay. Thank you so much. So,
Thank
Bye,
Siddhi.
you. Thank
sir.
you so much.
Take
Bye
care.
bye.
Bye.